Welcome to the deep dive. Today, we're looking at something, well, maybe a bit surprising about your pet. Their eyelashes.
Yeah, it turns out unusual eyelash growth is actually pretty common in dogs, though much rarer in cats.
Right, and we've got this detailed source text on these disorders full of stuff you might not expect, so we're ready to dig in.
Exactly. Our mission today, you could say, is to kind of unpack these conditions. We're talking trichiasis, distichiasis, and ectopic cilia.
Okay.
We'll look at what they are, who gets them, what signs to, watch out for, and importantly, what can actually be done about them.
Think of it as a quick guide for pet owners, right? To this often overlooked bit of pet health.
Precisely.
Okay, so let's jump right in. The source lays out three main ways eyelashes can, well, go wrong. First one up is trichiasis. What's the deal with that one?
So trichiasis, imagine a normal hair, like on the face near the eye, but it's growing in such a way or positioned such that it actually touches the eye surface. Either the cornea, that clear front part, or the conjunctiva, which is the lining.
So it's normal hair just in the wrong place, causing irritation.
Exactly. Normal hair, abnormal position relative to the eye.
Got it. Okay, then there's distichiasis. That sounds a bit more complex, maybe more hairs involved.
That's right. Distichiasis means extra eyelashes. But these aren't growing from the usual spot on the eyelid edge.
Oh, where from then?
They pop up from or very near the openings of the meibomian glands, the little oil glands right on the lid margin.
Ah, okay. The ones that help with tears.
Exactly. And the interesting thing is these extra lashes, well, they might not actually touch the eye at all.
Really? So a pet could have them and seem perfectly fine.
Absolutely. They could be completely asymptomatic.
Huh. Fascinating. Extra lashes, but maybe no problem. Okay, and the third one, ectopic cilia. What's unique there?
Ectopic cilia are quite different. These are hairs, maybe just one, maybe a few, growing right through the inner surface of the eyelid.
The inner surface, not the edge.
Correct. The palpebral conjunctiva. Our source says usually on the upper lid, but sometimes, on the third eyelid too.
Wow, growing from the inside. That sounds like it would be incredibly irritating.
It often is, yes.
Okay, now we kind of have a picture of what these are. Let's talk about who gets them. Is it common across all pets?
Not really, no. The information is pretty clear. These conditions are, well, quite common in dogs, but actually very rare in cats.
Okay, dogs mostly. Any particular age group?
It seems younger dogs are the ones most frequently affected.
Interesting. And you mentioned trichiasis, normal hair, wrong position. Can any dog get that, or are certain breeds more likely?
Well, technically, any breed could get trichiasis, but yes, there are definitely breed predispositions, often linked to their facial structure.
Like which ones?
For instance, facial fold trichiasis, that's where hair from those, prominent skin folds rubs the eye. Very common in brachycephalic breeds.
Ah, the flat-faced dogs. Pekingese, pugs.
Exactly. Pugs, bulldogs, Pekingese. Their wrinkles are the issue. Then there's trichiasis linked to something called eyelid agenesis, where part of the eyelid doesn't form properly.
And that's breed-specific, too.
That seems more sporadic, actually. It often affects both eyes, usually the outer part of the upper lids. We see it more in cats, oddly enough, and often with other eye issues.
Huh. Okay. And what about entropion? That's where the eyelid rolls inward, right?
Yeah.
That causes trichiasis, too.
Yes, exactly. The eyelid rolling in makes the normal lashes rub the eye. Conformational entropion, meaning it's due to their build, is pretty common in young dogs of certain breeds.
Right.
Oh, sharp eyes are a classic example. Retrievers, chow chows, quite a few others. But it can also happen because of, say, muscle spasms or scarring, or even if the eye is a bit sunken.
And cats. Do they get entropion?
Occasionally, yes.
Yeah.
Less common than in dogs, but it happens.
Right. So what about the other two conditions, distichiasis, the extra lashes, and ectopic cilia? Are there specific breeds prone to those?
Oh, definitely. For distichiasis, the source lists quite a few. Cocker Spaniels, American Water Spaniels, English Bulldogs, Beagles,
Okay.
flat-coated retrievers, dachshunds too.
Okay.
Interestingly, it notes that dogs with distichiasis are also more likely to have ectopic cilia.
A double whammy, potentially?
Potentially, yeah. And again, distichiasis is rare in cats.
And for ectopic cilia specifically, those hairs growing from the inside.
The breeds highlighted there are Pekingese, Shih Tzus, and English Bulldogs.
Okay, so owners of those breeds should probably pay extra attention to their dog's eyes.
Absolutely. It's worth being aware of the possibility.
Definitely good information. So if a pet does have one of these going on, what might an owner actually notice? What are the signs?
Well, the signs can really vary. Let's take facial fold trichiasis again. Because of that constant rubbing from the fold hairs, you might see excessive tearing, what we call epiphora. Also, you might notice pigment, like a brown stain, developing on the cornea, often on the side near the nose.
Okay.
And these dogs often have trouble closing their eyes fully. That's its legophthalmos. They might squint sometimes, too, especially if a corneal ulcer forms from the rubbing.
Yeah, that sounds pretty uncomfortable.
Yeah.
What about the signs for eyelidogenesis where the lid didn't form right?
With that one, because there's a gap or defect, you'll likely see inflammation of the cornea keratitis. That can even mean ulcers.
Ouch.
And again, incomplete eyelid closure and squinting are common signs there too.
And entropion, the inward rolling lid.
Similar story, really. Squinting, lots of tearing, and corneal inflammation, possibly ulcers again. You see how the signs can overlap quite a bit.
Yeah, definitely seeing a pattern of tearing, squinting, and potential ulcers. So what about distichiasis? How do those extra lashes make themselves known?
Well, this is key. Often they don't. Many cases of distichiasis are totally asymptomatic. The extra lashes might be soft or pointing away from the eye.
Right. You mentioned that.
But if those extra hairs are stiff or angled just right so they do rub the cornea,
Then you get the same signs.
pretty much squinting, tearing, maybe that pigmentary change or even ulcers. So seeing those signs, especially in a predisposed breed, is a flag.
Okay. And finally, ectopic cilia, those hairs from the inner eyelid. You said they sounded particularly problematic.
Yes, they often cause more severe signs, really noticeable squinting, lots of tearing, and a very characteristic sign is a specific type of corneal ulcer.
Oh yeah, what kind?
They tend to be superficial, sort of rounded, and typically right on the upper part of the cornea. And they just won't heal properly. They keep coming back.
Until the hair is removed.
Exactly.
Yeah.
Because the hair is physically scratching the cornea with every single blink. It's a direct cause.
Wow. So a stubborn ulcer in that spot is a big clue for ectopic cilia. Interesting how the signs vary. So why does this stuff happen? Is it just genetics?
Our source suggests it's often linked, as we said, to the animal's physical structure, like those facial folds and brachycephalics.
Right.
Predisposition is definitely a huge factor, strongly suggesting genetics are at play for many of these. And then, well, sometimes the cause just isn't known. Idiopathic, we call it.
So a mix of structure, genes, and sometimes just bad luck?
Sort of, yeah.
Huh?
Often a combination.
Okay. So if an owner sees some of these signs, suspects an issue, how does a vet actually diagnose it?
Well, the diagnosis really relies on a vet doing a very careful, direct examination.
Just looking closely.
Looking very closely, yeah. Using magnification, good lighting. They're looking for those hairs. Are they extra? Are they rubbing? What's the eyelid structure like?
Mm-hmm.
And it's crucial to rule out other things that could look similar. You mentioned entropion, eyelidogenesis. Those need confirming or ruling out.
Right.
And the source also mentions differentiating from other common eye issues, like dry eye or maybe a tiny foreign object stuck somewhere, or even an infection.
So it's more than just spotting a stray lash. It's a proper eye exam and process of elimination.
Exactly. Careful observation and ruling out mimics.
Okay, once it is diagnosed, what can be done? What are the treatments?
Treatment really depends on the specific condition and, importantly, how much it's actually bothering the pet.
Right. If it's asymptomatic distichiasis, maybe nothing.
Precisely. For trichiasis, though, where hair is definitely rubbing, sometimes, for mild facial fold cases, you might manage conservatively. Maybe use lubricating ointments to protect the cornea.
Does clipping the hair help?
Actually, the source warns against that for facial folds. Clipping can make the stubble even stiffer and more irritating.
Oh, right. Good point.
So often, surgery is the best bet to fix the underlying problem. That could mean removing the skin fold
Okay.
or doing a procedure called medial canthoplasty, especially for rubbing near the nose. That can also help with dogs that can't close their eyes fully or have mild inward turning there, or specific surgeries to correct entropion or eyelidogenesis.
So fixing the root cause surgically.
That's usually the goal for trichiasis, yes.
Yeah.
And treating any underlying issues like muscle spasms causing temporary entropion.
Okay. What about distichiasis, the extra lashes, if they're causing problems?
Right, they're symptomatic. Again, surgery is usually needed, but the techniques are aimed at the follicles. Options include cryoepilation, freezing the follicles, electroepilation, which uses electricity, or sometimes transconjunctival electrocautery, or even just plucking the offending lashes periodically, though they grow back.
Are there older methods to avoid?
Yes. The source specifically cautions against things like lid splitting or removing part of the eyelid plate. These are more aggressive and risk causing scarring.
Which could cause other problems.
Exactly. It could lead to cicatricial entropion scarring that makes a lid turn in or just mess up normal eyelid function. The aim now is more targeted, less invasive.
Makes sense. Preserve the lid function. And for ectopic cilia, those inner eyelid hairs.
For those, the main treatment is surgically removing the hair follicle itself, along with the bit of the meibomian gland it's growing from.
Cutting it out, basically.
Essentially, yes, a very precise removal. Cryotherapy, the freezing technique, can also be used sometimes on its own, sometimes after surgery to try and prevent regrowth.
Is regrowth common?
Well, it's noted that ectopic cilia can sometimes pop up in new spots later, so follow-up checks are a good idea.
Okay, so mostly surgical solutions tailored to the problem. What about medications? Do eye drops or ointments fix these?
Our source suggests medications are rarely the primary fix, because these are fundamentally structural or anatomical issues.
Right.
But they play a really important supporting role. Lubricating ointments, for example, can help soften stiff lashes and protect the eye surface before surgery.
Make things more comfortable temporarily.
Exactly. And sometimes, soft contact lenses can be used as a sort of bandage lens for relief before a procedure.
Interesting.
And, of course, topical antibiotics are often used around surgery time just to prevent infection at the surgical site.
So supportive care, symptom management, preventing complications, but not the cure itself.
That's a good way to put it, yeah.
Okay. So after treatment, what's the long-term outlook? What can owners expect?
For trichiasis, if you fix the underlying cause, like the facial fold or the entropion, the prognosis is generally pretty good.
Good.
But owners should know that any changes already on the cornea, like scarring or pigment, might be permanent. They might not disappear completely.
Okay, realistic expectations. What about distichiasis?
With distichiasis, because the treatments try to be conservative to avoid damaging the eyelid, regrowth of those extra lashes is definitely possible.
So might need repeat treatments.
It's possible, yes. Ongoing monitoring is often needed.
And ectopic cilia.
Prognosis there is generally good, too, after removal. But sometimes, maybe not every single problematic follicle was visible or fully zapped in the first go.
Ah, so regrowth is possible there, too.
It can happen, yes. Might need another procedure down the line sometimes.
Okay. So some ongoing management might be needed for some cases. Now, there was one final point in the source about breeding.
Yes, a really important one. The advice is quite strong. Affected animals should not be used for breeding.
Because it's likely genetic.
Exactly. Especially in breeds where these conditions aren't already super common. Breeding affected animals just risks increasing the problem in future generations.
That makes total sense. Responsible breeding is key.
Definitely.
Okay, so let's kind of wrap this up. We've covered these unusual eyelash conditions, trichiasis, distichiasis, ectopic cilia, all things that can cause eye irritation in dogs, much less often in cats.
And we've seen how breed plays a big role, especially in dogs, and how the signs can range from, nothing at all to quite severe issues like ulcers.
Right. And treatment often involves surgery targeted at the specific problem, with medication playing more of a supporting role.
That's it. And while some pets might seem fine, it's crucial for owners to know these can cause real discomfort and even vision problems if they're not addressed.
Early detection, appropriate treatment key for their well-being.
Absolutely.
Which brings us to a final thought for you listening. Given that genetics clearly play a part here, especially for certain breeds, what responsibility do breeders maybe have to try and minimize these conditions? And for all of us as pet owners, what can we do? Maybe just be a bit more observant about our pet's eyes. Notice that tearing or squinting or redness early on to make sure if something like this is happening, we catch it early and get them the help they need. Definitely something worth keeping a closer eye on, wouldn't you say?
I would indeed.
Thanks for joining us for this deep dive.